here, including some of the senior officials in the Department of Health. We have this very short briefing, but we want to thank you for coming over for this evening. It's been nearly 8 weeks since we reported the first case of COVID-19 in the country on the 5th of March 2020. It seems like an age since we made the historic trip to a small boys' school in KwaZulu-Natal, Cohen House. At this stage, we had hoped for a less dramatic turn of events, but South Africa belongs to the global community. And as head of the World Health Organization, Dr. Tedros warned not long after that no one will be immune from the devastating effects of the coronavirus. Thus, South Africa continued to import more cases of COVID-19. It was not long before we started seeing our local transmission. On the 27th of March, we made the difficult decision to place the country under lockdown in the interest of mitigating worse socioeconomic outcomes. What was supposed to be a 21-day lockdown was extended to 35 days lockdown. Today, I want to just give a sense of what was the thinking that was going on behind the scenes on these matters. At this point, I'd like to extend my sincere gratitude to all South Africans for your faith, for your trust, for your support, tenacity, and generosity. Our stewardship is only as good as your confidence, and you have really shown the world that through social solidarity and meaningful partnership with government, it is possible to beat the odds and come out stronger together. As of this morning, the pandemic still shows no sign of easing on this global sweep. There are now cumulatively over 3 million cases globally, with the USA having tipped the million mark, therefore suffering a third of the worst global burden. Over 214,000 have succumbed and 916,000 have recovered. China has long relinquished the title of being the epicenter of the outbreak and is now number 10 in the world. If you read the Chinese news, COVID-19 now occupies the back pages of their publications, and they have resumed with the progressive headlines such as the space race and launching of the driverless e-hailing taxis, etc. Here at home, currently, we've also seen an increase in our numbers of deaths. As of today, we have 4,996 cases reported in South Africa. The numbers of tests that have been conducted comes to 185,497. This is the largest, this is the highest we've ever been. And in the process, Western Cape is 1,870, Gauteng is 1,377, KwaZulu-Natal 919, Eastern Cape 616, Free State 113, Limpopo 31, Northwest 29, Northern Cape 17. Of late, we have been able to clear most of the unallocated who were actually part of the administrative challenge that we were going through. At this point, therefore, we want to sadly report that there have been 3 more deaths today, bringing the total to 93 deaths, where the 3 deaths have happened in the Western Cape. One is a 67-year-old male, and the other one is a 70-year-old male, and the other one is a 79-year-old female. And all of them did have some underlying challenges, which were some comorbidities that are associated with them. We do wish to convey our condolences to the families for the loss of their loved ones. We also want to convey our appreciation to all the members of staff, the professionals that have looked after these particular patients. It is important for us to indicate that we are very proud of the work that's being done by our professionals, in particular those who are in the front line, in the hospitals, in the laboratories, and in particular both the public and the private sector. It is important for us to say, as we are approaching the COVID-19, we're approaching it as a South African community. We don't make a big distinction about the people, whether they are in the public sector or the private sector. The studies have continuously showed that there is a strong association of adverse outcomes, that is with serious illness or death from COVID-19 infection with pre-existing comorbidities. If there are other underlying diseases, this tends to be a big challenge. The three that are currently emerging to be the most commonly associated comorbidities are hypertension, that is high blood pressure, and diabetes and obesity. The other challenges, the other comorbidities such as lung diseases, asthma, chronic obstructive airway disease, some of which are also seen amongst the smokers, are also very important comorbidities that have been associated. Also, the age above age 63, there's a majority of those who have faced the difficulty of this particular infection come from that age range. In our country, we have very significant burden of all these three diseases. So more than 1/3 of South Africans suffer from hypertension, and this was revealed in a study by Wits University that we have the highest prevalence in Southern Africa, as well as the largest number of people are not well controlled, even with treatment. Over 4.5 million people in South Africa have diabetes, and over 70% of women and 40% of men are also overweight or obese. These risk factors are important to take into account, because they are also serious factors when it comes to the conduct of the COVID-19 infection. We also still have an unknown factor, which is HIV and AIDS and tuberculosis. And unfortunately, South Africa has got the largest numbers, and therefore will not be in a position to learn from many other countries because they've got less of a challenge than ours. So we still feel, of course, are quite fortunate that our mortality rate has remained a bit low at about 1.9%, which is also attributable that most of the people today who have acquired the COVID-19 infection are healthy, young individuals, and therefore that tends to make them recover pretty quickly, except for these that we have indicated in our report. There are many others who actually have not passed away, although they've got the underlying conditions. And I think it's important for us to take the opportunity as well to appreciate all our clinicians, both nursing and medical and other staffs, who have played a very significant role in ensuring that we can actually keep the mortality rate as it is at the moment. So we remain very vigilant, although we have seen that the mortality rate in some of the countries in the Western Europe have gone up to as far as 14%. Now, all of these are indications for us that we need to do a lot of work amongst ourselves to be able to, make sure that we've got an impact, a very strong impact on the infection. I therefore want to take you through a few slides through which we want to give you an indication of some of the work that has gone on in the fight against COVID-19. And if it's possible to start sharing the slides, I hope that all of us who are on Zoom will be able to see some of the slides that we will take you through. So as soon as they can be shared, we will then take you through. But I think the first point, which we would like to indicate to the members of the public, is that the numbers of tests has actually been rapidly increasing, thanks to the hard work of all the teams that are involved in tracing contacts, in going out to community outreach, in ensuring that we refer those that we find with some symptoms into the system. The National Health Laboratory Services, the NICD, and various other laboratories, the private laboratories, and some of the institutions, research institutions, have all weighed in to give us increasing numbers of people who are being tested, who made sure that our numbers are increasing quite a bit. Having indicated that we've done 185,000 tests, I just want to give you a sense of how this has been going through. Now, I'm not sure if the slides are able to show, if they could actually help us to share the slides through so that we can be able to follow the kind of situation that we have. But if you just walk through went back to the week of the 6th of March, we had in the country something close to that week of March to the 6th to the 12th, with about 400 or so, 430 tests that were done. The following week, we did about twice as much, which was about 700, and then it went up to about 2,000, and it went up again to about 4,500. On the week of the 3rd of April to the 9th, we had actually increased the numbers to 6,200 on the private sector, and then of course on the public sector we had about 1,700. These numbers have continued to increase such that this week ending on the 21st of April, on the public sector, in fact, on the public sector, we have seen that there were two groups of people. On the people who are, or just the referrals to the hospitals, were done 14,000, and those who were referred from the testing, from the screening program, were about 11,000. So all in all, we were able to do that week just about 25,000. So this basically tells us that there's been a huge increase in the size of the samples that have been, in the numbers of the samples that were being tested in the public laboratory as well. So this is important, and the reason why I thought one needs to take you into confidence is to be able to look at the fact that there are two groups of people that were testing, three groups of people that were testing. There are those who go to the private sector, which has been happening all along, and the pattern hasn't really changed. Then in the public sector, the numbers of those who get treated, who get tested because they've got symptoms, has actually been increasing, and that's the 14,000 for the last week. And then there are those who are increasing, who come from the people who are being referred from the screening, public screening programs. Again, I really hope that we can actually get the slides ultimately shared. I'm not sure if they are visible to everyone. But what we then did, there has been an analysis made of all these tests. What it actually shows is that from the 6th of March, every week up to the 26th of March, the numbers of tests that we're doing every day was increasing. And this went up to the 26th of March when the lockdown was started. And from that time on, the numbers of tests started showing, the rate of positivity started showing a slight decline. But it has remained constant amongst those people who have been referred to the hospital because of their symptoms. In other words, those who were going to attend to the hospitals or clinics because they were not well, and therefore they were now being treated, and then they would therefore be tested. That remained at about positivity rate remained at around 3% thereabout amongst those who went to the hospital as patients on their own. Now, the next aspect that we looked at were now to analyze those people who went to hospital because they were referred from the screening. Now, again, that number showed that the level of positive tests had come up again. It is also stable at about between 3 and maybe 3.8%, which is remaining fairly stable if you look at it across from the 27th of March up to date. Now, these two have been very important for us because every day when we look at the results, we see the numbers are increasing. They never are stopping. They continue to increase. And we ask our epidemiologists to explain to us what is happening. Of course, we were concerned about two things that were supposed to increase the numbers. The first is that if we are going to go out and ask and look for people who might be positive and therefore refer them, the numbers should be higher because we're now seeking, we're going out to find the patients, we're going to find people who are positive in the community. Now that was one factor that we thought was important. The second factor was that whilst there's a lockdown, even though we have stopped large gatherings, large movement of people, the trend of COVID-19 has been of a communal spread amongst people who are associated together. In China, it used to be said that about 75% of the infection spread in family settings and in group settings where people are associating together. So we believe that that aspect would continue even though there's a lockdown, and we did indicate actually that this would be one area where we would be very concerned that people need to understand the message of staying at home. People need to understand the message of putting on masks. People need to understand the message of hand sanitation and the distance, because this is the only way after we put up a lockdown and stopped entrance into our main borders, we therefore found that the numbers of imported cases was reduced. And because it was reduced and then most of those people were put into quarantine or on treatment, that meant that from the point of view of the traveling community, there would not be a continuous source of increase on the infection. So the only risk of infection was now internal spread of infection, which could be happening on a person-to-person or could be a cluster outbreak where people are working together if there are no proper distancing and sanitations and masks and sneezing and coughing hygiene. All of those issues are what's going to be driving. Now we believe that's really what is driving our transmission rate. However, if you look at the slides we have, and if you look at the graph, it does show that the pattern of the positivity rate amongst the people who come in with symptoms to seek assistance in the hospitals and amongst those who are referred by the screening teams that are out in the community, the numbers, this positivity rate is not very different. In other words, there's a constant spread of infection across the two groups. So it therefore says to us, we have not seen what we would have also thought would be a problem of a rapid explosion, a rapid rise of the infection in the way that it had actually done at the beginning of the outbreak. So we have also noticed that the various parts of the country are affected differently. I'll probably try and come back to this slide a bit later on. I want to deal with this slide, which for those who may not see it, we have modelers, epidemiological models, which make certain assumptions and therefore looked at the infection and then felt that if you look at how it is going on in various countries, it tends to rise exponentially, quite rapidly, and therefore gets to a peak, which is very high, very quickly, and that peak tends to be much higher than what the health services can cope with. So when we started, we pleaded with all South Africans that we will not be in a position to stop the COVID-19 from coming to South Africa, and we will not be able to stop it from affecting anybody in the country. However, what we can do collectively is to delay the spread and therefore flatten the curve. So what our epidemiologists did, they then went and did a number of models. In these models, they then came with 3 scenarios. A do-nothing scenario, which is a scenario which we would have expected that there would have been a rapid and exponential, explosive rise of the pandemic, of the outbreak, immediately as it would have happened in a number of other countries. In this regard, it was felt that we needed to take some certain actions to try and defer the curve so that it doesn't occur immediately. Now, the scenarios that they put were that if there's an intervention, there's a best case scenario, which means we can defer the curve for a number of weeks and months to a point where the peak happens much later. The other one would be a pessimistic view, which means that certain factors might result in the curve being deferred, but nevertheless happening earlier than what would have been expected. So if you look at that particular curve, the one was supposed to be peaking around end of July, August towards September. Now that would be an optimistic curve, which means that if we did a lockdown and we did all the distancing, we will still not stop the curve from growing. But what it will do is we're likely to push it further, such that we are in a position to handle the cases that will reach our health facilities in time, so that we can cope rather than being overwhelmed. The pessimistic would have meant that if we didn't do much of distancing and we didn't do much of hygiene and all of that, it might come earlier around June, July. And those 3 scenarios are what we've been working on. So when the president called for a lockdown, we do want to again emphasize the fact that there actually was an impact. As a result, that particular lockdown stopped a huge movement of people and therefore reduced what would have been an exponential rise, because people were congregated close to one another. If it was big meetings, sports gatherings, and trains and coupes and taxis and so on, that would have actually made the rise of the outbreak to be pretty fast. In this case, we were able to delay it. Now, it was actually assumed in the process that it was able to push it by over 6 weeks away from where it could have happened. So when we did address the media a few weeks ago, 2 weeks ago, we indicated that the lockdown helped us to reduce the rate of spread. It didn't stop the spread. It just meant that the one person who's got the infection will spread to fewer people than would have been before. So we are quite pleased with what has happened. And therefore our model does show as well that even if we made the lockdown longer, it would not have necessarily pushed the curve much further than what it is already, which in other words means that at the point when the president says we need to be starting to ease down, it actually was based on the scientific projections that when the lockdown is eased, of course, not just all of a sudden, but that lockdown ease was based on the fact that all our calculations proved that there wasn't going to be any further benefit in terms of the epidemiological conduct of the outbreak if we went further than that. So then I also want to say that the further 2 weeks also added another advantage because it allowed us to ramp up the machinery of the health services to a point where we could increase the numbers of tests to a point where today we can say we've done 184,000 tests, where we can say today we've actually gone out and screened over 6 million people, where we can today say that of all the provinces, the capacity to test has actually been increased. There's been a huge cooperation that we have got from the number of people out in the community. Now, I want to mention that point because there has been a number of articles in the media. Some have actually said that there was no support for the lockdown. Others were saying that the decision of a lockdown was based on a faulty model. I do want to say that the model that was used, there were a number of models which were up there, which were put up by a number of academics. Those models were basically models which the first lot came from a group which was based in Stellenbosch, which was a real academic model to say, let's discuss the issue. When there was another comment which came from Professor Shabir, he raised the issue. They were arguing that point, but of course the media attributed it to the government using the wrong model or a flawed model. It's actually untrue that way. What actually happened is that there is a consortium that is doing the model within the Department of Health. That's the one that has got the kind of the slides that I was referring to, the one that's talking about the 3 curves that we were referring to. It's important to make that point because the projections that are being done, or the forecasts that are being done, are done by a number of groups of modelers. There is a group, for example, that's working with the business group that's doing its own models. There's also the Actuarial Society that's done its own models. So you will find that these models are out there, but we are trying to look for the best possible model based on the new information that's get added into the modeling formula as we move along. That has actually been that's been something that we were able to follow and work on. In the process, the report that came from the city press was saying that there was a loss of support for the lockdown. They said the support for the lockdown plummets. Now, obviously, the media is free to make their own reports, and also research can be done. But I thought that's important just to indicate that it tends to be misleading to look at it from the way the report was, because after 5 weeks, there was not a need for additional support for a lockdown. What the president has announced is the way that things are going to go, but we need to know that the formula that was used, the model that was used, had actually concluded that we need to start managing the lockdown as we move forward, rather than continuing with it as what it was. But in addition, it's also important to say that there were a number of other factors that had to be taken into account. That the issue of food security has always been topmost in our minds as government, and President has been quite elaborate in dealing with that issue. The issue of income security has also been very, very important. And the issue of the balancing of the economy, because people have to have a sustainable livelihood, has also been very important. So all of these together are factors that come in the context of how do we make sure that we contain the pandemic, but at the same time make sure that people can continue to lead the kind of life that is sustainable. So the president has adequately addressed those issues, and therefore we're not now at a point where all we're saying is that the basis on which the lockdown and the easing of the lockdown has been, those decisions have actually been based on very sound scientific basis. And we think that it's important to raise that issue. Some of the people started saying, well, why are people criticizing it? Actually, it's a debate amongst the modelers, but it's got nothing to do with the model that we took when we took this particular decision. And then, if one may just move to the next issue. The other issue that I want to address has also been the concern that has been raised by a lot of our members of staff. That relates to the question of protective clothing. I just want to say upfront again that our biggest ammunition on fighting the COVID-19 is the technical professional training amongst our health workers in the front line. It's important for the health workers to be well trained. It's important for our health workers to be well protected, to be ready to face up to the infection. It's our line function activity to fight outbreaks and epidemics in viral infections, bacterial infections as health workers. And therefore, there is no problem with health workers having to face the most problematic of the outbreaks. However, what becomes important is to make sure that for all of them, there must be adequate training, there must be adequate protective gear. In this case, we have actually noticed that the protective gear tends to be a moving target. One time you've got enough, one time we run short of it, and so on, particularly because the whole world is looking for this protective gear. We've also seen huge price escalations. All of these together mean that we are going to be facing challenges every now and again. However, within the stock that's available, we are assured that there is adequate stock to be able to share amongst all the various institutions that we work with. But we're working also with the Business South Africa to look at the available stock across all suppliers, as well as negotiate with the manufacturers out, particularly in China, particularly those because of the fact that there's a good relationship between us. So we are managing that issue. But because we have found that there are a number of concerns that keep getting raised, we have now discussed with the Occupational Health and Safety Committee to be strengthened so that the public sector, private sector, trade union representations, academics and senior leaders within the government can work together in this team. We actually have asked that they must work with us to actually help to audit some of the stock in the various hospitals so that we've got information on all sides to be able to say at any one time if there's a concern, we are able to address that matter. So we will continue in that kind of way to be able to assure our professional staff that they will be protected, that will always listen to what concern they raise so that we are able to deal with this. This is particularly concerning because there has been a number of instances, particularly as we have seen it in the private sector. There have been a large number of health workers who've been affected, who have been infected. If I'm not mistaken, the number of health workers who have been infected will be probably close to 135. This covers largely public and private sector, and amongst these, there's been some doctors, nurses, technicians, and other members of staff. So we have gone in to check on what was the basis of their infection. So it's obviously it was easier on the earlier days because those where people had been traveling, they had a history of travel. But of course, of late, we're now dealing with internal travel. Now, the internal travel internal transmission. Now that makes it always difficult to work out where the source of the infection is. However, amongst all of these, there has been one fatality, and that was a doctor who had retired in the Free State, who was now just doing sessions here and there. He had traveled abroad, came back, and then contracted COVID-19, and then passed away in the first in the early days of the outbreak in the Free State. So again, we were certain to have lost a colleague in that way, but that's the one that we've got a record of any health worker who has passed away. But the others will release to the media the distribution of where in every province, whether there's been public or in private, where we've seen the infection that it has been detected. It's important for us to indicate that from the point of view of the Department of Health, we take quite seriously the issue of the safety of our staff. So we do want to assure all our colleagues, our stakeholders, particularly amongst the unions, as well as the members of staff, that we do take seriously the issue of their safety. And from that point of view, we do want to indicate that it's important for us to work with them until we are sure that we don't have anyone who's exposed unnecessarily. I'll put that issue on the side, and then I wish to also make another additional comment, and that is that amongst the issues that were announced by the President on the packages to assist in the fight against the COVID-19 was the issue of the support that needs to be given to the Department of Health. Amongst the issues that we are focusing on in this regard is to look at the additional requirements for the department. Firstly, the issues of protective gear are in the package. The issues of additional sustainable supplies of medication is also in the package. The issue of employment of additional professionals into the health services is also quite important. In this case, we had already focused on the issue of the employment of doctors. When we went towards the end of the year, we actually ensured that all the interns were placed appropriately. Then we also made sure that all the post-interns who had gone to community service were also appropriately placed. Then we went on to then address the plight of those doctors who had finished their community service but were now concerned that they may not be employed. This particularly arose when the doctors in Limpopo raised the issue with me and the MEC, and the issue was that they felt that they may not be able to get their posts. So we had a whole discussion with all the MECs that there were, in some instances, vacancies which were not funded. In some instances, there were frozen posts and so on. We all agreed that the agency of employing the doctors did not need further elaboration. So we then approached the Treasury to assist in this regard. And I want to say again, from the Cabinet, from the MINCOMBAT, which is the Minister's Budget Committee, and from the Minister of Finance personally, an undertaking was made to say that the numbers of doctors that need to be employed must be employed, and Treasury was determined to find the additional resources to cover those doctors. In a number of provinces, we actually found that the doctors who were needing to be employed were all employed, and we ended up with no additional doctors to employ, particularly in Gauteng. And so we then made a specific provision that whenever the provinces are looking for additional doctors, they must go ahead. And of course, we've got our own arrangement of how we're going to assist on top of whatever their budgetary constraints might be. So I want to assure all our professionals out there that where there are particularly doctors looking for a placement, it is important for them to contact their own provinces. I've actually checked that a few provinces have been issuing adverts calling for doctors to come on board to make applications. So at the time, beginning of the year up to this current month, we have been still looking for more doctors. But some of you might recall that even last week, when we were in the Eastern Cape, we actually went through a discussion with the MEC where we were assisting in the administration to increase the numbers of nurses and doctors and some of the administrators to fast-track their appointment, which has been done, and I'm grateful for the work that the MEC has done in this regard. So because of COVID-19, we understand there's going to be additional pressure. So we would therefore like to say to our professionals, we are going to be taking more people in. We have even called for some of the retired or the volunteers to come on board, even if for short term. So we would like the provincial governments, provincial departments to be able to indicate when, where, what addresses, what numbers they would be able to utilize to show people to be able to take up employment. I'm making this point as well because it does appear that there might be some concerns that are coming from a number of doctors. There's a group of doctors who qualified in other countries outside South Africa. When they came back, they were not registered, so they could not be employed. Now, that one is a difficult one because for everyone, you have to be registered through the Health Professions Council of South Africa. In this case, you cannot practice unless you are registered. And every now and again, I have to tease the Deputy Minister to say, I'm registered for the year, are you registered? Because it's actually a very important issue for a doctor to be registered. But some of them have got challenges relating to the schools where they were trained, and some of them have got challenges with the entry exams. Now, those doctors are not possible to employ until they've gone past that aspect. So sometimes when you hear that there are doctors not employed, those are the ones, but unfortunately that is an issue that has to be resolved with the Health Professions Council of South Africa. We have therefore also noticed that of late, particularly with the lockdown, some of those doctors who had ventured into private practice, some of them have actually made themselves available to come back to serve in the public sector. Well, again, we have an understanding with all the provinces and the MECs that in this regard, they will therefore be approaching those where they are available to take them up and make sure that they are employed. So that is the issue. Now, despite all that, we have felt that we need to augment and reinforce our professional cadership. So this is the basis on which we have gone out to seek assistance from Cuba, from China, and we've actually been talking to a few other countries to see what support is possible from some of those countries. It is in this context that we have yesterday morning received 217 doctors of various description, of various training and professions and categories from Cuba. This meant to us that they are coming to augment what South African resources are, human resources are. So it is important to say that the Cuban doctors are coming at our request to reinforce, particularly because they've got particular strength in the case of community medicine. That is where South Africa is very weak, and therefore their presence is actually very helpful when we have to deal with the issues of approaching situation such as an outbreak like we are facing, where you have to actually cordon off a community and look at the health of the entire community and the spread of the infections, analyze it, and look at how we can intervene at a community level. This is because our model is more hospice-centric. It's about you get sick and then go to the hospital. In Cuba, the model is different. You get seen before you get sick, and they prevent you from getting sick, and you don't have to go to the hospital unless it's necessary. Now, that is the model which we will ultimately achieve when we get our national health insurance. But we welcome these Cuban doctors. We welcome them quite warmly, and we want to assure everybody that they will not take anybody's post. They will actually be placed as a medical brigade that's come to assist us. And in the process, they will be working alongside with South Africans. We are also discussing with the deans of the various faculties of medicine, because the deans have also offered to bring out some of the students, particularly the 6th years, the 5th years, so that they may be part of the group that is fighting the epidemic on the ground. So we welcome these doctors. We have actually allocated these doctors on a weighted basis, depending on where the epidemic is the hardest. So, for example, we have 26 that are going to be allocated to the Western Cape. These are going to consist of 18 feminist physicians who are really more on the community health side, which is the strength which I've spoken about. Then we've got others who are health technologists, 5, epidemiologists, 3, biostatisticians, 3. Now, they will actually help to analyze the outbreak, the trends on the ground, and therefore help us to structure our strategy on a block-to-block kind of basis now. The Gauteng is also going to be having 27 because of the fact that that's where the biggest pressure is. KwaZulu-Natal is going to be having about 28 as well. And in this case, I think Gauteng will have 29, KwaZulu-Natal will have 28. And every province will be having some of the specialists from Cuba. So there will be some going to the Eastern Cape. Eastern Cape will have 20, and then the Free State will have less. They will have about 17, and the Mpumalanga will have 13, and Limpopo will have 13, and Northwest will also have 13. Northern Cape will have 11. So they will be spread right across on the basis of the weight of the outbreak. When we find that the outbreak is shifting, like what has happened, Free State has done a brilliant job in the way they've managed to contain the outbreak. In that case, we're very worried about a huge explosion, but they've been very aggressive in dealing with it. So they've managed to maintain it at just over 100 people for the past few weeks now. And in fact, we believe that it has given us a hope that we can contain this infection in a number of areas. So all in all, these specialists will be going to these particular areas, but we also will be reinforcing with all the teams in the various provinces, and the additional people that we'll employ, they'll also go and be reinforced. We have to up the game at this point. We are going to up the game. We have now seen that in some of the areas we have got cluster outbreaks, and this is in the Western Cape. And on that basis, we need to really spare more efforts to make sure that there's adequate support that is put onto all of these areas. This, for me, is also a very, very important issue, because Cuba has always supported South Africa. We have in the past got a large number of Cuban doctors who have assisted us. We've actually got right now, when we graduate, over 700 students to become doctors who have been trained in Cuba. So I want to thank Cuba, wholeheartedly for the continuous support that they've always given us. And we've also known that Cuba has sent medical brigades to Italy, to Spain, to Latin America, and many other countries. And so we actually feel very fortunate that they've been able to come and be with us. Once we have dealt with the issue of screening, they will be released. We are taking just a precautionary quarantine. It will not necessarily be a 14-day quarantine, because we've now got full report that they were actually in quarantine for 19 days in Cuba, and they've been given tests, and so we need to verify that at a certain point, because in any case, Cuba has got about 1,200 cases, when we're now growing at about 5,000. They're just much less than what we've got. So their risk is much less, but of course, they've already been checked, and so I'm quite happy that that's been happening. We're very grateful to the president for going out to approach these countries to give us the assistance that we've got. So for us, we're going to be working very well with these Cuban doctors. Let me say at this point, because I've got lots of my colleagues here, Deputy Minister is here, the Director General and other senior officials and senior leaders within NICD, the MECs are here. You will ask your questions, and when you do, we will obviously share these questions amongst all of us. There might be specific things that you might want to hear. They might also have some issues that they feel that they need to comment about. So I'd like to give that opportunity for that. Let me hold it at that and say thank you, and I hope that we can clarify any further issues that will be coming forth from yourselves. I will hold it at that at this point. Thank you very much.
Thank you, Minister, for the presentation. We will now request the MEC for Limpopo, Dr. Popo Ramatula, to make a few remarks, specifically, Minister, with regards to the issue of the employment of medical officers.
Evening, Minister. Evening, Minister. Hello.
Thank you. I can hear, but I'm muted.
Hello. Yes. I missed the last part. What I think was saying I should comment on is the appointment of doctors. Hello. 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 Hello.
Hello. Can you hear?
Yes, I can hear.
Okay, you might just want to comment briefly on the issue
Yes,
of the appointment of doctors. You had the protests in your province, but also the issue of screening. You've been doing quite a lot of screening lately. Just 2 or 3 minutes.
Oh, okay. No, thanks, Minister, and good evening to colleagues. What we want to indicate is that, yes, indeed, we had a challenge in terms of appointment of not just medical doctors, even other healthcare professionals category, mainly as a result of the resources, especially looking at the budget constraints. Because if you look at our composition of employees, it's been the highest in the country, where we are sitting at 76%, leaving us with just 24% for goods and services, and the direction of the Minister of Health and also the Minister of Treasury, because we can confirm even this afternoon that at the end of January, beginning February, we've been able to appoint 60 of those medical officers, and also at the end of now March, we also appointed an additional 20, and I think also this particular week we will be appointing additional, because the staggering is as a result of community service medical officers do not finish at the same time. So there are those who are still going to complete in June. So we have received that particular funding to appoint the medical officers that were not appointed. And as the minister has already indicated, as a province, we've already, of course, been in contact with the IPAs who are representing a majority of our GPs in the province. And also that we want to request their intervention, especially looking at the question of community screening, which brings me to the second issue too, because most of the people have been asking, how did we manage to get those numbers that we have been able to screen? What we need to indicate as a province is to say there's been a lot of planning and putting systems. Immediately after the president has pronounced and the minister has also requested a plan from each and every one of us, when are we rolling out the massive testing and screening campaign? As a province, we couldn't start immediately because we have also raised our concern as addressed by the minister that we were having challenges of PPEs, looking at the stock availability of our surgical masks and even gloves, even sanitizers, because those were the three key issues that we needed for our field workers that we were going to deploy to different communities to screen. We waited and the intervention also of the minister, and I remember the weekend when the stock was delivered and we received a lot of donors. We want to thank the captains of industry who came on board when they heard our plight. Now, as soon as we knew that everything was in order, we then launched the whole testing and screening, and it was launched by the Premier. We must also indicate that there has been that political leadership at this level, because all the MECs, cabinet MEC, were deployed to support our community health workers in all our areas. We were able to deploy over almost 10,000 of those cadres, different categories of our peer, mentor mothers, our lay cancers, our home-based carers, all the directorate cadres whom we have been utilizing all this time can do in the past. So they are used to this particular work and they are known to different communities. So having done that work of getting to launch, we made sure that they were trained even prior to the launching. We want to also thank our partners, your Red Cross, your ANOVA. They came on board in assisting, training, and instilling confidence in them to go and do the work. Now, then that's when we were able to release them and they were able to work. If you calculate the strategy that they've used to say, if each and every field worker on a day can target to visit 10 households, in a household, you have got an average of 5 to 7 individuals. So you can see that within a day, you could have covered 50 individuals. Then given the 2 weeks or given whatever time you were given, able to cover all those. In the beginning, of course, we had glitches wherein some of them, you will be told there are reports there and there, but because of the systems that we already put in place, where there is supervision from a local operational manager in the particular clinic, and also the fact that our tracer team, comprising of 589 professional nurses, are the professional nurses we drew from the local areas in our different clinics who were supporting this particular community healthcare workers. So, and then we place a data capturer in each and every clinic so that when they knock off in the evening and they submit the stats, immediately that statistics is captured and be received in the head office and also sent to CSIR. So that work of doing a lot of planning and also building the capacity really assisted us. And lastly, Minister, we had all our district executive mayors taking ownership of the screening campaign because they all went to launch their own districts, and ward councillors were even supporting our field workers with transport if they must move from one village to another. As you know, Limpopo geographically, it's huge and it's vast. So they were able to do that work, and we have been able to achieve the numbers that we've been achieved. Now, that's why we want to move to a second level now, where we are going to be engaging also the services of our GPs who knows the communities and the burden of disease, so that we can continue with this work of screening, not only, by the way, of COVID-19. We are also looking at other burden of disease.
Thank you, MEC. We will now allow MEC for Health in the Western Cape, MEC Zongo, to discuss the cluster outbreaks which are occurring in the Western Cape. The Minister has made mention of it, but the MEC can just also elaborate. Thank you.
Okay, thank you. I hope you can hear me.
Yes, we can hear you, MEC.
Okay. The majority of these big clusters, which we dub them as bushfires, as was indicated by Professor Karim, mostly are coming from the supermarkets, from the factories. We've got also the clusters coming from the police stations, subs across the Western Cape. And also we have some of those that are coming from the prisons and also some of the factories. And in total, we get about more than 250 makeup of the cases that are coming from these clusters. Taking note that these are not necessarily the contacts of the cases. Hence, for us, the crucial thing was about to activate our case detection team in order to have the rigorous tracing of the contacts, noting that these are the essential services that bring a lot of economy to the communities. And some of the workers, they are not necessarily reside in the areas where they work, meaning that now the contact team has to go across the sub-districts within the metro and also outside the metro. I think the learning lesson here that we need to pick up is about health alone cannot be able to tackle this, because when you are in the workplace environment, the issue of the occupational health and safety, where you need the Department of Labor also to monitor in regard to the issues related to the regulations. Also the responsibility of the employers in terms of issuing appropriate PPE, because PPE is not only related to the health professionals, but across, depending on what type of work that you do. Plus also the issue related to the space that is being needed, even by the environmental health. Where do we put them in regard to, especially with a shopping etiquette, because the bulks of the groups within the shops, where we find that there's no social distancing that is happening, and that exposes even the shoppers themselves in terms of the infection. So these are the learning lessons we had. But what is crucial going forward in terms of the response, hence we have to activate more of the isolation sites and also to add more the quarantine beds, so that to provide for the contacts, taking them away, especially for those who are coming from the high density and vulnerable communities. But also what is important is about how do we, because we've got quite some of the pockets of the hotspot areas as a result of these clusters, how do we ensure we could be able to do the mop up within days, 2 days or 3 days, to see to it that now we attack the whole area in terms of the decontamination, as we do as employers in the spaces of the workplace where there is an infection. So it's one of the lessons learned that community screening and testing, mass community screening and testing might have a limitation, might not have many of such, but you can be able to balance when you have such clusters, which there are more than 10, I'm just quoting a few of those, where you get balance with the clusters, but you make it a point that the positive cases that are coming from those clusters, you have to make it a point that you follow up the contacts and the traces. And also you work again with the business and economy. Like today, I'm coming from the rural area where I have an engagement with the employers in terms of how they can ensure in terms of protecting their employees in order to stop the spread. Thank you, Minister.
Thank you very much, Amy. MEC Kwamba.
Good evening, all.
Use this opportunity, MEC, just to take us through the outbreak in the Eastern Cape and what measures you have taken as a province to respond to the outbreak. Thank you.
Thank you so much, and good evening, all colleagues. Well, in the Eastern Cape, as we all would have noticed in terms of when the outbreak did start, we adopted an approach that was district-based, as our system is. And in the district base, this side it will be health and the other side it will be local municipality. And all local municipalities under a district would be forming their own structures in terms of reaching out to all community structures, be that they are churches, be that they are the traditional leaders. But when they get to that, it then suggests that our job flows from when it is chaired by the Premier of the province up to a point that it is chaired by a local municipal mayor, where we are then getting on board all our community health workers, all our traditional leaders, all our structures on the ground. And that on its own actually suggested that we're able to actually target even the rural areas in our area. I do want to say that we went well as we started. However, at a point, our numbers surged, and they did not surge precisely because we're not doing anything, but they surged because people started to disregard the regulations. The funerals in our area hit us a bit hard, one in PE, one in Port St. John's, and equally they affected 4 major areas because the last one is just added on, which is Krisane. As the numbers were going up, we're forced then to go back to a drawing board and start to talk about what is it that we do. We did embark on the mass screening, and up to a point that as the Eastern Cape, we've surpassed the 500,000 mark in terms of mass screening. And out of that, we're able then to actually talk about what is it that we're getting in terms of the numbers that you all see, where out of that, we're able to talk about tests that actually tripped a scale of about 10,000. And when we look at those issues, because people were, if you take, for instance, PE, people were not concentrating on what it is that they should be doing. It was business as usual, and that to us was the big challenge, and it is still a big challenge. The relaxation and the opening of a social grant actually took a bad turn to influence the issues that were happening. As we speak about what is it that we're doing, all areas, we started with hotspots. Having started with hotspots, we're able to actually say, as we analyze the impact, we were then able to say, can we look at the ripple effect? In East London, that has worked. We were starting to go low. However, in Port Elizabeth, we're still having an issue. What is it that we're doing in Port Elizabeth? One of the issues was to immediately look at the employment of district managers at the chief director level, of course. We've subsequently employed those. However, on the basis that we've already been matching what we need to do vis-a-vis the issue of quarantining and the isolation. We've subsequently now got on to employ a mix of healthcare workers that exceed 300. It is not the end, however. As we look at that, we're also able to actually start to make use of the assistance provided to us by National Health Department. We're grateful for what the minister did, which we believe is what he does to everybody in terms of assisting us dealing with issues. As we speak now, we're able to see the renovations and what is it that we actually targeted as to opening our beds in the areas. I think in the next 2 weeks, we shall be seeing a lot of areas in the Eastern Cape having completed field hospitals, having completed isolation, having completed areas that are actually helping to look at us. However, what then becomes an issue is that we're starting to see now the advantage of ensuring lockdown and equally isolation of our people. They are starting to come out of the quarantining, no, the observation of the isolation. We're seeing better numbers now in terms of them completing their 14 days. We're lucky that we're not having people who are positive again after 14 days as the Eastern Cape. It does have to be stressed, the whole issue of movements in provinces. Eastern Cape is hedged by the border of Aberdeen from the Western Cape. We are now approaching a season, series from the Western Cape, and we're having serious problem of people who are coming in numbers from the Western Cape, and that's putting a lot of strain in that border, that side. And again, the many funerals that come from that side are giving us a problem. However, we have done now a situation where we've put a permanent isolation space in that area so that those people don't pass through. It must be understood that sometimes you cannot stop funerals. So something must be done in terms of funerals, whether we change regulations of how people are actually buried, that it does not become a choice of the province, but rather that all of us actually deal with the issue of funerals in the same way and uniformly for the whole country. The next issue that I would want to actually pose in terms of this session would be the whole issue of administering grants. We're now nearing that period again, and I'm starting to wonder whether it's going to work as we deal with social development grants and people flocking to towns. The third issue is the whole issue of people getting into towns and people getting out of town. What you are seeing is pathetic, where people get into town and taxis stop moving. And those people will sit and stay in town, look at them, their fats and everything, dripping and everything, and people are sitting and not even observing distances because there's no space. So I would wish that at a time there could be a reconsideration of how those taxis actually move people out, that at least they take them out of town and none are actually allowed to come in. Maybe the other issue would be the whole issue of dealing with cross borders. I'm not sure whether by the end of the month things will be relaxed. However, it is becoming a challenge to say at this time, we are starting to look at that. The team that is sent to the Eastern Cape is bearing fruits in terms of how we see the planning now. Also, on the issue of the PPEs, whilst the issue of PPEs is having some assistance from the central, should I say, sourcing of PPEs, it is at the same time creating some negativity in terms of local SMMEs. I would wish that there could be some way of considering the locals as to how they then benefit from the centralized process. I think by that, I would be representing the Eastern Cape, and thank you very much.
Thank you very much, MEC Gomba. We will now ask the MEC for Health in Gauteng, Dr. Bandile Masuku, to also make some comments. We need MEC Gomba, if you can just mute on your side. We'll allow Dr. Masu to just discuss firstly the Cuban support, and then we understand that Gauteng has got a significant number of community tests that is conducted. If you can also brief us on that, and then deal with the issue of recoveries. Thank you, MC.
Thank you, and good evening, everybody, and good evening to all South Africans, and good evening to the Minister. I would like to start by indicating that as Gauteng, we have been doing quite great in terms of our recoveries. A whole lot of numbers of people that have been active cases since our first case on the 5th of March have actually recovered. Currently, as we are speaking, out of the figures that we have from last night of 133 infections, we have got 197 recoveries, which is a great feat in terms of what we've been doing. And this is attributable to what the Minister spoke about in terms of our young population and in terms of the affluent population that has been affected, and also because these individuals are quite fit and they're able to withstand the symptoms. So our recovery rate has been very high, and currently we're only remaining with very few active cases. We're working around the clock to make sure that we continue with that rate of our recoveries. And one of the things that we are happy with is also our tracing, particularly the tracing of the known contacts. As we are sitting today, we are actually looking at 100% tracing that has happened in the last 24 hours. And all those who have been traced have been, of the known contacts, have been able to be traced. And in that figure, we are also looking at the number of those who have been discharged as contacts, and it's a number of almost 67% of all those who have been contacts have been successfully been traced and have been discharged from being monitored and with medical surveillance. The next issue that you have requested me to address is the issue of the Cuban support. The Cuban support is welcome, but we also have to re-emphasize the point that the Minister has made, that it doesn't take away our obligation as the Department of Health to employ as many as possible of our healthcare workers. In Gauteng, in the beginning of the month of April, we did advertise and launched a website, a health portal where people can be able to do e-recruitment type of forms that have been filled. In that form, we've been able to get 8,000 or so applications of different categories. And we are in the process of processing them and in making sure that we are able to employ. The first phase will be the ones that we'll be employing now to start in the 15th of May. The second phase will be the ones that will start on the beginning of June. And then the last phase will be the ones that will start actually middle of June. We are continuously filling the post, and we are making sure that all our hospitals are actually, in terms of capacity, are ready. You will recall that one of the things that we are interested in is to build the capacity that will last and stay with us even beyond the pandemic. And this is what we are actually working on, and it's something that we are actually dealing with. And we are quite pleased also with the number of things that have actually happened within the province. One of the aspects that I think we need to address, Minister, is that there have been a technical glitch that has happened in our province where some of our staff members wouldn't be paid their committed overtime. The finance, the treasury department, and our department HR are working off 24 hours to make sure that glitch is actually resolved, because we do value very much the the role that our healthcare workers are playing in carrying the healthcare system. The last point that I would want to address, the issue of community screening and testing. I think we also have to applaud the stint of the Department of health in Limpopo in their numbers that they've got, and we as Gauteng, we are also having screened 1.3 million individuals across the board, and we have able to test 16,000 of them. We are pretty much working out to make sure that we get enough testing kits so that we're able to ramp up our testing. We are quite happy so far with the response that we have received from different partners, particularly from private, who have offered us testing machines and also offered us to employ people who will work the machines, the PCR machines that they've offered us. And we do have a patient engagement app called Impilo app, which helps us in a great deal to make sure that people are able to do self-screening wherever they are, and they can be located by the tracers. So one thing that we need to also continue to emphasize is that we are going to continue to screen first before people get tested, and our screening and testing will still be focused. In Gauteng, we are screening people in hospitals, we are screening people in our clinics, we are screening people in a community activations that we are doing every day, and hence our numbers are actually increasing. But we'd like to call upon maybe all the Gauteng citizens to download the Impilo app and be able to have the control of screening, just for them to be able to do screening every day in their smartphones and be able to be traced when is actually required. So at the moment, we are quite happy with the work that we've been doing. It's not enough. We are hoping that over the period of 2-3 months, we will be able to deal with what the pandemic will actually throw at us. We are working in terms of the beds. I think the last time we spoke and talked about our beds, we are looking at the beds of almost 8,300. And this is the bed number that we have, which we have from both the private and the public sector. And we are committed in construction of 800 or so extra capacity in terms of the beds. Here again, we'll have to remind the people and remind the citizens that we are looking at beyond the pandemic and creating capacity within our own facilities before we even look outside. The Nazareth field hospital that we have started and launched last week Friday, and the president visited. The first phase has been completed. The second phase is about to be started, and it's one of those that will also add up in terms of our capacity. So by and large, that's what we are doing. We are appreciating the assistance and the help that is coming from our compatriots from Cuba, which have got a very strong sense of public health and also in terms of prevention, and are going to assist us in doing proper public health education and doing proper actual contracting. But we just have to ascertain this to the public and to our healthcare workers that they are not taking and we are going to employ and continue to employ everybody. And actually, thank you. And I think we've covered everything. Thanks, Minister.
Thank you very much, ABC Masuku. I will now request the MEC for Health in KZN, Ms. Nomagugu Simelane Zulu, to also just share regarding the high mortality rate that we have witnessed in KZN, and also the investigations that have been conducted by the provincial health department in some hospitals. I'll also request the MEC to touch on the recruitment of extra staff for the hospitals in KZN.
Good evening, Minister. Good evening to the colleagues, and good evening to everyone on the line. Let's really firstly appreciate the opportunity that we are getting and appreciate the presentation that we have received from Minister. From the province of KwaZulu-Natal, we have, as Usibu indicated, the first one is the issue of the mortality rate that we are faced with in the province. I must indicate, Minister, that we have been engaging amongst ourselves as the province in wanting to establish and understand exactly why our death rate is at almost 30. It's today it's 30 mortalities. Now, when you look at that death rate and you look at the numbers of our infected patients in the province, you can see that they are not in proportion. Now, clearly indicating that there is an area where we are having challenges in terms of people that need to come forward and indicate their status. What we have realized as a province is that the majority of the people who were tested previously were those that were coming from affluent backgrounds, or those that could afford medical aid or going to a private facility. Therefore, they were able to actually go to private hospitals and get tested. We have now found that we are at a level where the local transmission is an indication that our people, the majority of our people, do not have the capacity nor the time sometimes to go to a health center and get tested. Therefore, they don't come forward to be tested. Hence, we then decided that this community screening and testing is something that we actually should prioritize ourselves. The reason I'm raising this particular issue is because when you link our mortality rate with our infections, there's a clear indication that there are those that are out there that are positive, but we have not been able to pick up as government purely on the basis that they've not been presenting to our facilities. Therefore, that's why we had to strengthen our program of going to the communities, because we needed to get ahead of the virus, and that is how we are going to do it when we test. However, we have requested a couple of clinicians and scientists in the province to actually scientifically analyze the trend that we are faced with in the province, so that they are able to give us something that we can work on, and something that and solutions really to say how best can we address the issue that we are faced with. I must indicate that we are quite worried as a province about this trend. Having said that, of the 30 people that have passed on, the majority of them, well, not the majority of them, but about 14 of them come from St. Augustine Hospital, or are linked with St. Augustine Hospital in one way or the other, which then leads me to the next point that was raised on speaking about the investigation. We have received as a province a number of complaints about a few facilities that are run privately or private hospitals, on how some of them, it's alleged that they are not following proper protocols. Some of them are not giving their staff PPE as they should. And as a result, we ended up with the challenge that we're faced with in St. Augustine. I must indicate, Minister, that the case really of St. Augustine is quite worrying. Out of that case of St. Augustine, we have picked up more than 50 positive health workers and a number of patients that are at least above 10. Now, that is a very serious worry. However, what we have then done is that we requested the facility to close down, and we sent a team that was going to make an assessment and understand exactly what is happening. But subsequent to that, we then received a number of other positive cases and deaths that were coming out of that facility. And then we decided that we now need to conduct a thorough investigation on actually what is happening, or what has happened, what has led to where we are in relation to St. Augustine. And we then, that investigation is going to provide us with a direction on how to act if we need to act. If there's been any wrongdoing, we will then be able to implement whatever measures that we are given to us by the law. But if there are correction measures that we will need to speak to the hospitals about, then that is what we are going to do. So that is what we have done in relation to St. Augustine. But about a few days, about a week or so back, we then received another similar situation in a hospital that is from the same group, and that hospital is in it's called Kingsway. It's in the south of the province. Now, it's a similar situation. More than 10 health workers have been infected. A number of patients are also infected. So we've now decided to club these particular investigations together, so that we are able to to decide once and for all on how best to move forward. I must indicate that we are getting a little bit of pressure from different sectors wanting us to open the 2 facilities that we have closed. But we are standing our ground to say we are not going to be able to open the facility until we know what has happened and until we are convinced that the correction measures have been put in place, and we are going to continue to do that. And as soon as we have the report, then we will decide on the best way to move forward. But being that as it may, that issue of those private facilities has really worried us as a province, to a point that we even called a meeting of the CEOs in the province who are running private facilities and had some engagements with all of them, and we agreed on some protocols that we are going to follow so that we get to understand really what is happening on those facilities, so that we don't continue to be exposed or expose our people to this particular a situation that we have been faced with. I also want to indicate, Minister, that in relation to our screening, it is going quite well. The province again also didn't start on time because we had to train the different people or the different health workers that we are working with, including those that are coming from our different partners. However, the moment we were ready and people were on the ground, we have then been able to move quite swiftly. I must indicate that in the past 2 weeks at least, we have tested more than 1 million people, which is a serious achievement in relation to what we want to achieve. Finally, the issue of staffing, Minister, I must indicate that the province of KwaZulu-Natal, I think, unlike other provinces, was in a slightly different, or is in a slightly different situation, in a sense that we have always had a challenge with our staffing because of our cost-cutting measures that are implemented in the province. There are some categories of staff that are needed in every facility that we could not employ over the past 2 or 3 years. Now, when the coronavirus came, we had to establish facilities. We then had to sit down and indicate and get a sense of how are we going to make sure that all these people that are needed in the facilities are going to be employed. We have been given authority by the Premier and our finance or our treasury to go to employ, but we are going to be offering a contract of about 6 months for this particular phase. Then immediately after this phase is over, we'll then be able to go back and now thoroughly look at what needs to be done so that we are able to resource our facilities as they should be resourced. So we are quite happy about that, and this is the process we are going to engage on before the end of this week, so that by next week our facilities are manned, and the people that need to be there, your nurses, your enrolled nurses, all of them are actually in place and they are able to work. Finally, Minister, I just want to indicate in relation to our beds, as a province, instead of starting with the field hospitals, we also decided that we needed to reconfigure some of the facilities that we have. When we looked at some of our other hospitals, we realized that there were hospitals that had a very low bed utilization, and as a result, we then started moving patients around, particularly those that come from the same district, and repurposed some of our hospitals. And we have started taking a receipt of those hospitals, and they are coming up very nicely. Yesterday, the Premier, myself, and the social cluster, we went to visit one such hospital. It's called Clearwood Hospital in eThekwini Metro, and we were able to present to the Premier what has been done. And what we have done as well, just like Gauteng has done, we also decided that it's important for us to also invest in our own facilities, so that in future, as we are all preparing for NHI, at least we have an investment in our own facilities. But that is just the first part of our beds. The other beds that we are going to be getting those from the different field hospitals that we are currently working on, and in about a week or so, some of them are going to be ready, and we'll then be able to report on them. I must also, though, indicate that we have received a number of donations in terms of beds from a couple of hospitals. One hospital is called Escort Hospital in eThekwini. They gave us their full hospital for free, and we have more than 120 beds that we are going to be utilizing from that particular facility. And I'm mentioning this, Minister, because it is quite important as other private facilities have insisted that we needed to pay a particular rate, and a rate that was unaffordable to government. So we really appreciate the donations that we have received, and we hope that other private sector people can also be able to come on board and be able to donate for the greater good of our society. Thank you very much, Minister.
Thank you, MEC. We would also like to give an opportunity to the MEC for Free State. Minister did make mention that Free State is a good example of how this pandemic can be contained. MEC for Free State. MEC Moteng, do we have you?
Because I've been muted by the, okay. Thank you. I struggled to unmute because the host muted me. We indeed have done very well, because by the time we got the first people that got infected in our province, the confirmed cases, it was not one, but more than one people. It was 5 people at the church, as you may all know. Immediately when we received when we got the results, we immediately went to the church, and at that point we requested the pastor there to call everybody that was at the church for the duration of the conference. And we went there. We would like to thank the minister at this point in time, because that is when we got the 2 mobiles that came to the Free State. The 2 mobiles helped us to go to the church, the hotel, and then trace all the contacts of the people that were at the church at that time, immediately that time when we found them. We then from there mapped the contacts of the people who were at the church. With the help of the cell phone companies, we were able then to go to the communities and do the tracing of the contacts, the screening and testing. I must say that something that helped us again to be able to have dealt with this problem is the issue of lockdown. Because now people started to stop the movement. We were then able to trace the contacts because they were not moving out of Bloemfontein. That helped us a lot, because we were able to get almost all the contacts. We are only left, I think, with 4 people that we are struggling to get at the moment. The issue of us getting the contacts helped. Because we are having the local transmission at the moment, all our teams that we are having at this point in time are working in the township, and just a few of them are still in town, because we still have people that are testing positive in the suburbs. And every time when we get a positive case, because we don't get as many people as when the infection started, we map the contacts and follow those contacts. But we have got a team of the teams that of community healthcare workers, together with the Red Cross volunteers, which were trained to trace the people. And we have we go and have a tent in each site where we are embarking on mass screening, where then people are referred to our vans, that is the NHLS vans, where then we are able to swab the people there. And so far we have worked well, because we have screened 606,285 people to date, and we have tested 4,847, and we only have confirmed cases of 113 to date. So I think we are managing, but we do not want to be complacent. Hence, we have also now started to increase the nurses that we would want them to come and join our teams. Particularly, we want to work on this issue of protecting the employees. We want to make sure that at each facility we have a gateway testing, screening and testing ward of the facility, where we would then place a nurse. We are training our professional nurses who will do the swabbing. And then we are going to be allocating the enrolled nurses and the enrolled nursing assistants at this gateway facilities in our clinics and the hospital, so that we do not miss even one patient that would get into our facility having not been tested or screened, and then we do not know, and then ultimately that person would then infect the patients or even our staff. So I think the way we are doing, we also would like to thank the support from our partners like the University of the Free State, the Right to Care, the NICD, the National Department of Health, the WHO. Yeah, those people have helped us a lot, because all the cases that we have in Free State, we also discuss them and manage them with the help of the clinicians and also the epidemiologists that have been in our province. And we have a daily meeting where we discuss all the new cases that have been found. We have a discussion among them and also plan for the following day. We plan so that any new case that come in, we have a team that would go and work around the contacts. We do not wait for a day or two. We work immediately. We follow the contacts up to the workplace. So I think that is what has led to the winning solution that the Free State is having. And at the moment, we have got 96 people that have recovered from the 113. So we only have a few of the active cases, and we have about 10 that are hospitalized, and none of them are in ICU. So I think we are doing well. So we're going to increase the staff. We're going to employ more nurses. We're going to employ even more community healthcare workers and train them, because we want to be ready when the care, if we could get more, the increase of patients that would be positive, because we are doing testing at a rapid response now. So we don't want to be found wanting once we get more positive cases. So we are increasing our staff. We also now we are going to be employing the doctors, and we welcome the help that would come with the Cubans, because I think that would help the Free State to do the wonderful work that we are doing. And I thank you.
Is it true? What's the name?
Thank you, MEC. We will now request, before we are going to be taking questions from the media, but we just want to also give the MECs, all the MECs, just to briefly, make remarks. We're going to request the MEC from Mpumalanga to also make a few remarks. MEC Manzini, you are sitting at 24 right now, confirmed cases at 24. Your numbers have been made very well. If you can just basically share Mpumalanga's experience and how you responded to this outbreak. MEC, if I can ask that you mute yourself. Thank you.
Okay, thank you very much. Evening, and thank you, Minister and colleagues. In Mpumalanga, as you've correctly said, we are at 24 confirmed cases now. And I can say that out of the 24, we have got 18 recoveries, and we are monitoring 6 cases. And we can indicate that they are recovering very well. And however, we are not going to lose the ball and say that we're relaxed. Because we are having such a small number of confirmed cases, we are going to continue conducting our community screening and testing. And also that in terms of our screening, we have started screening, and for now we are registered around 12.3% of the population of the people of Mpumalanga, and we have screened 562,051 of people in the province. And we can indicate that in terms of the numbers of the households which we have screened, it is increasing, but slowly, of course, but we are targeting to say maybe by the end of the lockdown, we have at least screened more than 800,000 people. And we can say that over and above that, we have our website, we are doing self-screening, and out of that, we have registered 9,760. And we can also say that these numbers does not include the day-to-day visit by members of the community to our clinics, to our also in terms of hospitals. So we can say that the number is more than what we are reporting based on what is happening. But this report is only on the door-to-door program that we are conducting on a daily basis. And we can also indicate that out of the 3 districts that we are having, in Kangala, now we don't have any case that is positive for now, of which we are trying to make sure that we monitor it. Our epicenter is in Nkomazi municipality, and our worries because it was also in terms of the local transmission. So now we are working to, we have put more effort in terms of that area of Nkomazi so that we minimize further transmission in that area. Of course, in terms of our worry in the province is that you know that we are bothering your Mozambique, your Maputo, and also in terms of your Gauteng, your Limpopo, and Swaziland, and also your KZN, so that if we, in terms of the stage 4, we will be getting more people maybe coming back to the province. But however, as a province, we can say that we are ready. We'll work with all the different sectors so that we, as and when they come, proper screening and testing where those that have got symptoms, we are going to do that so that we minimize the further increase of numbers in the province. But what we have observed as a province is that in the main, we must look at the retailer, because if you look at your case in Nkomazi, more cases came out of one retailer, and then you have more people. But of course, like you're saying, this we've put more measures, and we appreciate the work that we are doing with the local municipalities. They are always supporting in terms of making sure that our people are accepted in their household, so that we don't have cases. We had minor cases there and there where people will not allow our community care workers, but now we can safely say that we are fine in terms of that. We have also identified quite a number of field beds that we are going to use, but however, we wanted to take a route wherein we are going to use our existing facilities, and of course in other areas where we're about to complete hospitals, we will do that so that we can have infrastructure even after the COVID-19, rather than only using the field bed that we are not going to be using after the COVID-19. So, but we can also say that private sector is coming on board. We have identified beds that we are going to use as a province in the different private sectors, and also mines. In Kangala, we do have a mine where they've donated their facility and use quite a number of beds to say that we can also utilize that. As a province, we can say that that's where we are, and of course, we are monitoring the situation very closely, and will from time to time work with the local municipalities and our communities, and also to make sure that as and when there's a need, and also indicate that the numbers that we are presenting, as I've said, it does not include the day-to-day. People are going in their numbers, because we are encouraging them to say, you don't have to wait for the team that are doing the door-to-door. If you see some kind of symptoms, visit your nearest clinic, go to the hospital, so that we are able to get you early than we are supposed to. Thank you very much, Minister.
Thank you very much, MEC. Would like to give an opportunity to the MEC for Health in the Northern Cape, MEC Manopole. MEC, you also have been sitting comfortably at 17 at this stage. You've got the lowest rate of infection at this stage. Can you also just share with the country your preparedness?
Okay, thank you very much for the opportunity. Good evening, Minister, good evening, colleagues, and good evening, all South Africans. We can say that it's comfortable, but does not mean that we are supposed to be complacent as a province. Currently, there is some work that we are doing. We have been having some challenges with regards to screening, but we have managed to tease out those glitches. We have improved much on our screening. We have now, as I'm sitting here, as the date, the report that was updated by 12 o'clock today, 425,183, which is a good number that gives us. So with regards, that number is a composition of our facilities, and the mass screening to our community members, and as well as the ones at the roadblocks. So those are the composition of the numbers where we collected from. So we are ready that as we are prepared, and then as well as we must remember, all our 17 cases are mild cases. They don't need hospitalization. And they have progressed very well with the monitoring of our clinician, having constant contact with them. 10 of them have recovered, and it means that it says that it pays us, then means that we have 7 active cases currently as we speak. And those cases, as we were aware that those cases came as a result from the Free State, same churches that affected the Free State province. So the 2 of couple that went there, and then we end up having our own local transmission in our province. We are managing the situation very well. We managed to activate our tracers immediately after we have been informed in the cases of the private labs that the cases has been there. So there is the work that has been done. I think the immediate activation of our tracers managed to ensure that we put some plan in place. And then we have been doing a roadshow, visiting all the district, supporting them with regards to the screening. Hence, our numbers has increased. And then the provincial command council, under the leadership of Dr. Zamani Sol, is the premier, have put multi-sectoral programs were in place that the public works is assisting us as health to ensure that we revamp our facilities that is there. We set our approach to ensure that in our preparedness for any worst, for the peak, we must ensure that we revamp our facilities. I think we took the same approach as KZN. In the facilities that we have not been operationalized due to the budget constraint, we are utilizing those facilities that we ensure that we clear them and prepare for our COVID cases. So those are in the areas that the facility is not sufficient enough. We are planning to put marquee field hospitals and also park homes. So we should be also preparing for the NHIs in those facilities. Those are the things that I think we can report on. With regards to the recruitment, we ensure that we, by the end of financial year, we fill all the vacant funded posts that is there. 275 clinicians has been appointed. I want to speak particularly to the doctors. We managed to appoint 35 medical doctors who are permanent, and 36 are sessional doctors, which are already by some of them have started on 1st of April. Others, due to the lockdown, will be starting by 1st of May. So we can see already we have done some work with regard to the medical doctors and the nurses. It's 118 permanent nurses that we have appointed, and then about 50 are sessional nurses that have been appointed. So those are the categories that we, over and above the 2, and this just wanted to give to those 2 breakdown of the nurses and doctors that have been appointed already. We are welcoming, and Minister, we appreciate the number for deployment that you have been allocated to our province. It will help us, assist us a lot, because the challenges that you are confronted in our province, when we make out an advert for medical officers, most people who are responding are foreign doctors who are responding, particularly for the peripheral areas in our province, where it's in rural, in Namakwa, our province are responded, the foreign doctors are the one normally responding to the calls. So those are the things that we are doing very well with regards to the work. They are happy with the service that have been rendered to us. So that's the summary that I can give and say the work we are preparing for the West, but now we are managing and ensure that we screen and test those who needed to be tested. We welcome the mobile labs that you have received. Already we have dispensed them to different districts. So with that, saying that it means the numbers of of those needed to be screened, it will be much easier. They don't need for them to transport them because the Namakwa is a challenge. For them to test, they must transport to Western Cape. So you see the challenges that we're confronted with because of spatial vastness of our province. So all these labs, the mobile labs are coming to hand into us as a province. So for that, thank you very much for the opportunity.
Thank you very much, MEC. MEC Sambata for the Northwest has had a bit of a challenge, Minister, to come through. But I do have him on speaker. Minister, can you just show me your finger if you can hear him? MEC Sambata, can you say hello? MEC? Hello?
Hello.
Yes. Thank you, MEC. Can you also just share with us the provincial response at this stage?
Thank you very much. Our provincial response as the province is based on the assumption that we can't carry ourselves out irrespective of the numbers. So our response on the basis of the challenge South Africa is facing, but also on the basis of the World Health Organization assessment of COVID-19. As you understand that there are 4 districts. Each district has an outbreak response team and provincial insurance and provincial outbreak response team. We also have, like all other provinces, the provincial command council chaired by the premiers, in our instance, Professor John. Our response is not on the basis of ensuring that the heightened level of community awareness, in ensuring that those areas that we act on to prevent with species of infection by COVID-19, awareness levels the communities are extending. In terms of the provincial whoever the basis of this infection of national, irrespective of the number of cases. So we're quite aware of the necessity of how many beds, including first ICU beds, treatment beds, and facilities, and isolation facilities. So both private and public working together, we do have a standard operation system and that programs that covers both private and public, which standard operation procedure talks about quarantine and isolation, so that one day different vaccine facilities is private or public. And at the same time, a team of tracers, which team of tracers is responsible to ensure that we can do tracing very quicker, very immediately in person, receive the results. We activate our tracers to ensure that we don't spend more time. Like people who are contacts with us, we've been submitted to that contact list to us and 95 of them. One other is the national board screening of the mobile system. In that regard, we are about 7,000 people who are being screened in the province. Those the only challenges that the nation have less than who are tested, but if that condition is not that important, take a number of people before we take the possible.
Thank you, MEC. Thank you. I think what is important, the line is not so clear, but the important point which you have raised on behalf of the province is that despite the low numbers which are confirmed, you have strengthened your contact tracing and your screening. Thank you, MEC. I will now hand over to the Minister to respond to the questions from the media. DM, the Deputy Minister, Dr. Joe Pasha, is also on the line. DM, I'm also going to unmute you so that you can respond to the questions together with the Minister. Thank you, MEC. Thank you, Minister. We will start with 3 questions. The first question is from Kulia Malane Delisisa. Do foreign trained South African doctors and Cuban doctors both have to pass HPCSA exams to register in South Africa? What has been done to ensure people afraid of being taken to isolation units are not having symptoms and avoiding testing? I have heard from a few people in my community who fear being lost in the system if they get tested and find that they are sick. The second question is for the technical experts from Zweli Mkhize. To what extent can the vaccine development work done on MERS and SARS assist to fast-track a solution for COVID-19? Or is the makeup of spike protein and RNA for COVID-19 so very different that work will have to start from scratch? Second part of the question is, to get the maximum vaccine effectiveness of any treatment, where in the cell is treatment being targeted? The third part of the question is there a validated antibody test available to determine the constituents of how to develop the mechanism? And then the third question, it's Noni from Bloomberg, excuse me. I have 2 questions. One, can you explain the track and trace system, how it works, and what the progress has been with this system? Does it infringe on privacy rights of all? Which clinical companies is the department working with to ensure it was sufficient? And on ventilators, when does the minister expect first production of ventilators? Which ventilators will be manufactured, or will they be based on a global basis? How many ventilators does the country have at the moment? How many additional ventilators should be in the 8 countries? And when will the infection be reached? Thank you. Minister, can you unmute?
Unfortunately, I couldn't hear any of the questions. I'm not sure if the Deputy Minister could hear. Not aware, unfortunately. If you could probably, somebody text them to us, we'll try and pick them up. I'm not sure, DM, or could you get the questions? I couldn't.
Well, I only got the first one, but even that one, I'll deal with what I heard. I couldn't get the full question, but the part which I heard was whether foreign trained doctors and also including those trained in Cuba have to do the Health Professions Council exam. And the answer to that is that not all foreign trained doctors have to write the board exam. Depending on, there's a schedule of particular universities and medical schools from various countries, from which after various validation by the Health Profession Council over many years, the graduates from those countries don't have to sit for the board exam because their curriculum has been assessed and found that it's in line with the South African medical training curriculum. So that is the case. But those who qualified in the universities which are not part of those which have been validated then have to sit for the board exam. In as far as the Cuban trained medical students is concerned, these students follow a different path in the sense that they only do up to the 5th year of study in Cuba, and they come and complete their final year, what is called the student intern 6th year. They finish that in the South African medical schools, and they get examined by the local medical schools in terms of their clinical knowledge and academic knowledge, and they get assessed through an exam by the local medical schools. And after that, they again still have to sit for a final exam by the Cuban National Medical University. So they actually go through 2 exams, one by the local medical schools and then also by the Cuban National Medical University. And only then are they registered. So they don't have to sit for a Health Professions Council exam, having gone through this rigorous integration into the South African system. There was something about quarantine which I couldn't really pick up towards the end of that question. The rest of similar with you, Minister, I couldn't really, there was too much of an echo, which I could hear snippets of what the question seems to be, but I wouldn't venture into really speculating what the full questions were. Thank you.
Thank you very much, DM. Thank you for the response. I think you have really clarified the matter. Just a bit of history. When the relationship started between South Africa and Cuba, a whole group of professors, deans, and academics went to Cuba to validate the curriculum in Cuba. And out of that developed 2 programs. One was that there was a validation that allowed Cuban doctors to come and work in South Africa. Secondly, that South African students could go and be trained in Cuba. So people should remember that we've actually been working with Cuban doctors for a long time. This started way back in 1994, and it's always a bit strange when people act as though there's something new with working with Cubans and that there was some query with their qualification. In fact, we have a number of even current deans who have been to Cuba to validate their programs and to try and benchmark in terms of their training to actually assist us in South Africa. We don't have any doubt about the qualifications of the Cuban doctors. We don't have doubt about the Cuban medical training program. We don't have doubt about the Cuban health system. If we could reach that level of training and the level of organization, South Africa would be a much, much better country than what it is today. I think that we got used to hospice-centric system, which we think is normal. In fact, when we get the normal system, we'll understand that we've been missing out. So I think that the issues of concern here is that there shouldn't be anyone who feels that there should be any threat with the Cubans coming through. Now, I do have a question which I'm not quite sure the one that was asked, but someone has favored me with some of the questions. One of the questions relates to what has been done to ensure people are afraid of being taken to isolation units and not hiding symptoms. Well, we haven't really come across that experience in a big way, and so we have not had that as a problem. However, what we want to encourage people is to know that any treatment on COVID is for 2 benefits. One is to help the individual himself, herself, that they can be treated properly, particularly in the case that this infection complicates, because it can complicate, especially if people are not getting proper treatment. The second one is that the isolation is to make sure that the individuals don't infect other people. Doesn't matter to what extent you could fear anything, but you don't have a right to infect other people. So what I think is important is to just keep discussing, and if we are aware of such situations, please may let us know so that we can help the individuals, because there are too many reasons why people would fear. Part of it is stigma. Some of it has got more to do with people just not being sure what it means. And so we need to be assisted as well so that we can reach out to those individuals and help them to stay on, on the kind of program for treatment. The other question, which was meant to be for specialist experts, relates to what extent can the vaccine development work done on MERS and SARS assist to fast-track solutions for COVID-19, or is the makeup of spike protein and RNA for COVID-19 so very different that work will have to start from scratch? I've spotted in the team here that we've got Professor Cheryl Cohen. We've also got Dr. Anban Pillay. I'm not sure if Dr. Helen Rees is here. I'm trying to look through the names that I can see. So if we could ask that they answer that question. So if the first one can go to Dr. Cheryl Cohen, the second one is to get the maximum medicine vaccine effectiveness of any treatment, where in the cell is treatment being targeted, and then the third part is the validated antibody test available to determine constituents of how to develop immunity mechanism. So I'll leave it at that. If there are any takers, we would offer that, but if not, you might want to just comment on some of the questions. Could we actually ask that we unmute some of the experts we have? Professor Cheryl.
Thank you, Minister.
Thank you.
Dr. Cheryl Cohen has been unmuted. Dr. Cohen.
Good evening, and thanks for taking me for this question. I think so. So the first question on vaccines, I think certainly there's a huge international effort to develop different vaccines, and I think the answer to the question is complex. Certainly, a number of the strategies that are being explored are building on previous work done with SARS-CoV-1 and taking those strategies and extending them further for SARS-CoV-2. In addition, because of the huge importance of this virus and because of differences with the SARS-CoV-2 virus, there are also a number of really novel strategies that are not based on that. So the answer is yes. The fact that there was work on SARS-CoV-1 did kickstart the efforts, but there are also a lot of vaccine candidates that are looking at completely different approaches and really, which ones will come to market first. I think that's not clear. I think there was a question, the question on testing, and I wasn't sure exactly what was being asked, but just to highlight that obviously, certainly PCR testing, which is really looking for the presence of the virus RNA in people, is really still the mainstay of our diagnostic program to identify people infected with COVID and initiate public health responses. There is a lot of work on serological tests that are looking more at the immune response to the virus and trying to validate those different kits, but those types of tests right now are much more in the surveillance area, perhaps to understand population immunity and how many people have been infected over time. And then also there's a very big push to develop more complex assays, in fact, to understand the body's immune response. And as these vaccine candidates come forward and start being put into clinical trials in humans, and hopefully some of those trials might be in South Africa, then there will be additional work that will be needed to be done to really understand the immune response in people who receive these vaccines and don't receive these vaccines, to understand how vaccines might work. And certainly in South Africa, we have a very strong history of expertise in evaluating the immune response to HIV for vaccine candidates, and hopefully this type of expertise and capabilities may come in useful as we have SARS-CoV vaccine candidates coming forward. Over.
Thank you, Dr. Cohen. If we can have the next question, please.
Thank you. I'll proceed with the next set of questions. Okay. We have a question from Nomapolani, SAPC. In Senegal, there's actually testing kits being used that cost $1. Is there a plan to move to rapid tests that are cheaper? I then have a question from Sophie Mokwena, SAPC. Minister Mkhize, what is your reaction to the proposal that the ban on cigarettes sales be lifted? The second part of the question is, China says it will take some time to trace patient zero. What impact will this have on the work that is being done to understand how the pandemic started? The next question is from Nelly Yonka, Media 24. Did I understand the minister correctly that he said the maximum effect of the lockdown has been reached after 5 weeks? But taking into consideration the impact on the economy, why do we still continue with a phased lockdown? Are you waiting for another point in number of infections to be reached? At what point will we go to phase 3? I then have a question from Zolega Kotashe. My question is, how will the department change its efforts in screening, testing, tracing when the country reaches level 4 on Friday? The minister had said that the lockdown, level 5, had assisted in slowing down the spread. And then the last question in this series is from Lulu Mkhize. Please request Minister to clarify the fact that exercising in stage 4 is allowed, but under strict conditions, as this is vague. Can runners jog in the streets, as some of us don't have yards to run around as we stay in flats, shacks, backyard rooms, townhouses, etc.? Thank you, Minister.
Thank you very much for the questions. The first question relates to what's happening in Senegal. Our Ministerial Advisory Committee is getting as much information just to understand what is happening and so to what extent we can learn from what's going on there. But we have worked together to look at various kinds of kits that we can receive so that we can improve the testing capabilities in the country. And in that process, we're also looking at numbers so that we can negotiate the best possible price so that it becomes more and more affordable. But we are also looking at possibilities of self-sufficiency and manufacturing to happen inside South Africa. Obviously, under the pressure of the pandemic globally, it's a bit difficult to have something that we can put on the table as we speak, but it's something that in the long term would be in our interest to not only be self-sufficient in the manner of the test kits being produced in South Africa, but also to be affordable, as well as also looking at alternatives of what other technology we can use that could be discovered to assist. So we are open about it. However, we are noting that there are those developments in Senegal. We also have been in touch with a lot of manufacturers just to make sure that whatever we get, we can be certain of its quality as well. The next question was around the ban on cigarettes be lifted. Well, the issue basically is that when the decisions are taken, a whole lot of factors get considered. I would not want to address myself on those issues other than just to say, from the point of view of the health department and the impact of cigarettes, there is no basic reason why we could recommend cigarettes for anything. to start off with, it's got its own contribution to ill health. The causes of cancers, particularly cancer of the lungs, is one big issue. The issues of complications in cardiovascular diseases. If anybody's got a heart attack and you're smoking, it makes it worse. If you've got cardiovascular problems, it causes what we call peripheral vasculopathy. If you're looking at people with hypertension, it might actually complicate that, and so it can contribute to what we call atherosclerosis, and which creates some damage of the blood vessels in the body. It makes people to be prone to bronchitis and other chest infections, and makes it easier to get other infections. And therefore, there is no real reason, if you want to get our opinions on the matter, there's no reason why we would ever recommend smoking for any reason. We've made a lot of legislation to reduce smoking, not only just direct smoking, but even secondary smoking. So that's really all I can say about it, as it were. The other issue of tracing patient zero, there must be a lot of academic research work that has to go into that process. Certainly, it would be useful to find out where, the kind of evolution of the infection. But I think it's a very tricky issue. But I think if China is able to do that, it obviously will take us to probably understanding how the zoonotic transition from animal occupation by this virus into humans, under what conditions it happened, and all of that. It might be very interesting academically. It might be a good scientific research that might need to be followed on, but we're a bit far from that. Where we are, we really want to know what do we need to do to actually treat and manage all those who are affected by this infection, to a point of reducing morbidity and mortality. And that, I think, is one area where we're focusing. Then the question about the lockdown. Well, the point about the lockdown, I think the President has explained it quite clearly. The issue is, when we started with the lockdown, we were wanting to slow down the viral infection. Now, to suddenly open without putting in place the necessary mechanisms for limiting the spread, such as the washing of hands, sanitation, use of masks, and ensuring that people use distancing and so on. If you just go back to normal as how things were before, we're actually going to, in those curves that I referred to, we're going to go for the second curve, which is an early explosion, which means we can have a rebound infection very quickly. And so the phased ease of the lockdown is to make sure that we change our behavior. We begin to understand that whether you are in a train or in a bus, you need to keep the distance. Even in the supermarket, you need to keep the distance. If you're working in a factory, you need to keep the distance. If we haven't learned that in 5 weeks, it's going to catch up with us. And therefore, we are asking that the industries, the employers must begin to prepare for their own employees to be able to be protected at work and in transit. And also, we have to get our communities to understand that day-to-day activities, the problems of big meetings, the problems of large, social events has got a risk in it. You need to get our people to prepare for the return. And the return can't just be, precipitous. It has to be phased, where we start by looking at how we are all easing into the new social conduct. But even apart from that, it's also important to say the nature of the spread of the infection has not stopped completely because of the lockdown. We've just heard MEC Mbombo from the Western Cape talking about cluster outbreaks. They've had to close about 3 ShopRite shops because of this problem. They had to close down a factory. It's going to get worse if we don't learn anything out of it. And so we need to slowly ease off. And before we know it, we'll have infected the most vulnerable. We've got concomitant infections. We've got particularly the senior citizens. And we will then soon lose control of the epidemic. And I think the president has put it quite clearly that it's important for us to manage to save the gains that we have, to maintain the gains that we have already achieved, and then because of the change of behavior, prolong the the rate at which the infection might actually overwhelm our services. That's really what we're busy with, and people must not be flippant about it. There was a reason for the lockdown. The fact that we have not seen so many deaths as we're seeing in the rest of the world does not mean it cannot happen in South Africa. So people do need to respect what has been the guide so that we can at least save our nation from the infection. So if we just go precipitously and just all of a sudden get everybody back to work and we didn't make any preparations, we don't take any precautions, well, it was a waste. Then we actually didn't learn anything and we didn't make any necessary preparation. So I think that we need to take it a lot more seriously. The number, we're not waiting for another number of infections to be reached. The lower the number, the better for us, so that we can prolong it. So there's no magic number we're looking at. We're going to persevere. When the numbers get beyond 5,000, we have to persevere, hoping that people will understand what the message is and they will actually work together and cooperate insofar as reducing the spread. Then the other question is that the testing and screening will not change. We've just only screened about 6 million people, but we've still got another 54 million people to go. So as many as we will be able to, we will not really reach the 58 million or so, but we will actually need to test as many just to be able to get a sense of what the prevalence of the infection is. But we must also understand that even though we test people, doesn't mean that once we have tested you, the infection won't come after the screening and the testing has been done. So we need to always remember that the screening and the testing helps for people to improve their awareness so that they can try and take the necessary precautions. But you can still be tested, screened and be tested and you're negative, and then a few days later you are now positive. We must be aware that there is no immunity that will come from screening and testing, but it will help us to be able to identify the extent to which the infection is ravaging our community. The last question is about exercise. Well, exercise is good, and where possible, we would like to encourage people to exercise, but exercise doesn't mean you have to all get out of your house. You can do exercise in the house, you can do exercise in your room, you can do exercises everywhere. But in this case, the real challenge has been about how do you deal with a situation where everybody in the neighborhood decide to go out on a walk, on a jog, or walking the dog. Then it becomes very difficult to say you've got a lockdown. So that's really, those are the things we're grappling with. We really are very sympathetic to the fact that this lockdown has been very, very strenuous. We do understand for everyone that our normal day-to-day activities have been, reduced, and there's been a problem because we've not been able to do whatever we wanted to do on a day-to-day basis, even to stay healthy. We do understand that it's one of the sacrifices that we do appreciate from our people, that they actually, respected the call by the president to stay indoors. So we are not completely unaware of the inconvenience that this is causing. We just ask that people must please bear with us until we can really get over this difficult time. Then we would then be able to get back to normality. But in the meantime, once we're busy trying to manage this virus, can we all cooperate and work together? So really is more a question of saying we understand that there is a lot of inconvenience and the constraint that this whole requirement of a lockdown is bringing. However, we do want to plead, really bear with us. Let's try and see how we can work through this thing together, collectively, in a phased manner. As the President said, risk-adjusted uplifting of the lockdown so that you don't have a rebound infection immediately that will cause us a lot more of a calamitous outcome from such a very successful process up to now. We still have a lot of challenges to face. The winter is coming and there's going to be a lot more infections, and we don't know what happens to the infection as you move on with the next few months, as it reaches out to a lot more communities with comorbidities and so on. So let us really try and do our best to push the infection further and further away, and also to flatten the curve. So we really are pleading for your understanding. That's all we can do.
Thank you, Minister. We will just allow for the very last round of questions, 3 more questions, and then we will close the session.
Thank you, Minister. I have a question from Zaid Jadwat from Salam Media. Under current projections, how likely is a resurgence of the virus once the lockdown is eased? And the second part of the question is, have there been any cases of reinfection thus far? If not, what knowledge do we have about the possibility of this? I then have a question from Sarah Evans from News 24. What is the minister expecting to happen to the rate of infection after the lockdown is downgraded to level 4 on May 1? Is he expecting the rate of infection to rise, and if so, by how much? I then have a question from Malcolm Doskan. How do you get COVID-19 infection from touching your eyes with hands contaminated with the coronavirus? Thank you, Minister.
Thank you very much. I think the first 2 questions are kind of related. Issues that relate to human conduct are very difficult to predict. So we can never know how the virus or the outbreak will present, how it will evolve depending on how people behave. So what we anticipate should be our focus should be about if we can keep to the basics of keeping the distance and making sure that when people go back to work, they go in a phased manner, so that there is no sudden exposure of people to a new infection. We expect, for example, that for every workplace, there should be a way of screening people. Before you come in, we should know whether you don't have a fever, you're not coughing, you don't have a sore throat, you don't have any symptoms that could suggest that you could be having an infection. If we can find that information early, that information will help us to be able to prevent infection spreading at the workplace. So it's really more about changing the approach and making sure that we can be more proactive to prevent infection from spreading silently. Even if we knew all those symptoms, we knew everyone had no symptoms, doesn't mean that there couldn't be someone, a small number, that could still have the infection without having the symptom. So it's even more important that we must use whatever armaments we have to try and deal with reducing the risk of infection. Yes, the infection is still rising, and as you see the numbers, it's still rising. We don't have a magic figure that we're looking at. So we're going to keep watching on the trends and then decide if there's any extra intervention that is needed. So for example, once we say that there's stage 4, and we're saying that others may not, we might need to open up, it may not follow that everyone needs to be treated exactly the same way. There are areas where there's not been infection at all. There are areas where there's a huge amount of infection, and therefore it might call for a lot more of drastic actions to try and contain the infection. I think we must always be open to the fact that there may well be some interventions that are needed. And when that situation arises, we must actually plead that we must not use sensationalism, exaggeration to make it even less possible for people to cooperate with the steps that would help them to improve or to avoid the spread of the infection. Sometimes it's easy to sensationalize issues and stir up emotions and make people to be agitated. This is unfair, you don't have this, this is the problem with your rights and so on. When all we need to do is to cooperate and say within limits, we need everyone's right to be protected, we need everybody's health conditions to be such that we can work together to improve and protect. And at the end of the day, the balance of what extent we can have normal economic activity depends on what is the rate of the infection in that area, how prepared are we as the health department to deal with those situations, and how well is the community response and containment coming up, and to what extent, to what extent could the workplace be exacerbating the infections. All of these issues are issues that we have to take into account, which basically boil down to one issue, and that is to say, let us all take responsibility. Each and every one of us has a responsibility to ensure that we reduce the spread from one person to the other. Thank you very much. I think that kind of covers some of the questions. If there's something missed, you could just indicate, Chief of Staff. And we also would like to just check if Professor Shisana might want to make a comment at some point before we close. Thank you.
Thank you, Minister. May I request Professor Shisana, she is the health advisor to the President, just to also make a comment, as she has been very involved in this work. Thank you.
Thank you very much for the opportunity to just make a very quick comment on so far how we've been dealing with this COVID problem. Let me say that our country has had a very good organized program of dealing with the COVID-19 crisis, in the sense that it had a very clear organized plan, the plan that was led by both the President and the Minister of Health, together with the Deputy Minister of Health. They've really ensured that in implementing it, they're informed by science. So there's been a lot of involvement of the scientists in the thinking of what it is that they are supposed to be doing in dealing with this pandemic. It's impressive when you look at the literature from other countries and where they are beginning to look at how countries have actually dealt with coronavirus. And for South Africa to be seen as being in the top 5, in the world in terms of how we've dealt with this virus. And I'm just hoping that all of us are going to support these initiatives, as they keep telling us that we should have a lockdown, we should wash our hands, we should take all the preventive measures. Let us continue to do that, because in doing so, we are protecting the lives and preventing our health system from collapsing, under the COVID. We've seen health systems collapsing in countries that you would have never imagined that would happen. I mean, if you think about the countries in the north that were not used to dealing with infectious diseases, have really, really struggled. And we in South Africa, we must say we've done relatively well. We're not saying we're out of the woods yet, but we're saying that we've done reasonably well, and we have to congratulate our leaders and support them and make sure that they continue to do as good a job as they've done. Thank you very much.
Thank you, Prof. Shisano. Minister, if you can now wrap up the session for us. Thank you.
Thank you very much. Let me say thank you particularly to the members of the media and the public who have joined us in this conversation. We want to apologize for a number of technical glitches that we have experienced. And obviously, we have learned a lot during this lockdown with virtual meetings. But we want to thank even the sponsors who are who's assisted us to connect at this level. We've had a record attendance of a large number of people today. So I want to say thank you to all of you, particularly my colleagues, the MECs, the senior management, the Deputy Minister, and our members from various teams, NICD, the Ministerial Advisory Committee. Thank you to all of you. What we have to always remember is that as a government, we must remain accountable to the public, we must remain accountable to South Africans, and therefore part of what we do is to be able to be transparent about what we are doing and what's happening. And we want to also indicate that we have a huge appreciation for the support that we have received from all our people. We get messages, we get people who are making suggestions, we're getting donations, we're getting contributions, we're getting everything that our people are doing. We do appreciate that. In fact, even though there are instances where we complain about people doing the wrong things, not observing certain things, we have seen that the majority of our people have really respected the call from the president. So I want to thank the president as well for the leadership and the cabinet for all the work that they've done and all the leadership that they've given us. And the technical teams that are at the back of this work, there's a whole lot of committees, experts, and groups that are working behind the scenes to make this program the success it is, as Professor Shisano was indicating. So I want to thank also the ministry team and the technical teams and communications that have been part of this arrangement. Thank you to everyone. Let me just say, in regards to the future, we must always know this: we are dealing with a dynamic situation. We will, as the Chinese once were used to say, we will be crossing the river by filling the stones at the bottom of the river. In this case, we're going to be monitoring and evaluating what is the progress in various parts. So it must be expected that there may be areas where it may not be the best way to just release and get everything to go back to normal immediately. In some instances, you might need to, still consider lockdowns. It might be instances where you have to consider, heightened interventions of various forms. All of those issues mean that we will rely on your support and your cooperation. It's still a long way to go. There's been good progress up to now, but we really have to say the winter time is coming. A lot of work is being done, but also we do expect that there's a lot of pressure that's going to be coming to our community because of the winter, the flu, influenza infections. So we must really work together. We must unite, we must cooperate, we must make sure that by the time we get to the other side, we can look back and say, yes, South Africa, we did it. It really is possible. Some of the examples that we've seen on what is happening in various provinces mean that we can actually do a lot more to reduce the rate of spread and flatten the curve. So thank you very much. I really wish all of you a good evening. At this point, we would like to bring the meeting to a close. Thank you very much. Bye-bye.
Thank you, Minister. We will be circulating the slides to all members of the media, and they will be posted on the health website and so on.